and eczema are no friends. Hi everyone, my name is Ejeomah, I'm a pharmacist. Ever since I started working with a dermatology specialist, I have been becoming more aware about skin conditions and about the ingredients that are in our everyday products. So I have taken on the interest in learning about skin conditions, and in the journey of learning, I thought I should also share with you. In this video, I'll be discussing about eczema, also known as atopic dermatitis, the causes, the symptoms, and the treatments. So let's get right into this video. Atopic dermatitis, also known as eczema, is a skin disorder that is caused by an increased reactivity of your skin to allergens and irritants, and people like this are most likely to be affected by asthma or allergic rhinitis. So there are other factors that can actually exacerbate these conditions. That includes environmental factors, climatic factors, and psychological factors. For instance, it has been proven that if a parent has atopic dermatitis, there is a 20% chance that you might have atopic dermatitis. And if two parents has this, there's a 50% chance of you developing dermatitis. For the onset of the disease may start at any age. Onset is usually from 2 to 6 months and above, but some can actually happen at the later times in life. One of the major manifestations of atopic dermatitis that you know that, oh, this is atopic dermatitis, is something that you call xerosis, and that is dry skin. So you see that your skin is very dry, and dry skin is easily irritated because there is a decrease in the amount of ceramides and lipids. Other symptoms include itchiness, and you can also see like some red rashes. You're a lighter complexion, and for people of color, you see like raised bumps on your skin. When it comes to treatment, these are the things that you must ensure. Number one, make sure you're not using a harsh soap or detergent. Stop using any soap that is very harsh for your skin or detergents that is harsh. It is important to go for soaps that are mild and that are moisturizing. Go for non-drying mild soap out there. There's the Nivea, Cerave, Neutrogena, and even facefact. Using their face product. I'm using the one for sensitive and dry skin. Go for products that are for dry and sensitive skin because usually they are more moisturizing and less harsh. Another thing you want to add is a bleach bath. Bleach bath is very great for sensitive and dry skin. If you are in the room, try to make sure that you are free from anything like dust in your environment, heat in your environment. So try to make your place a lot more aerated. You can also add humidifier to your home just to keep the air moist. Also, another thing you have to do is to reduce the time and the hours that you spend in the shower, and try to use warm or even cold water when you are taking your bath. You want to try as much as possible to remove anything that will cause heat. Another trick you can do is to, this is a dermatology proven one, you can add olive oil, a little bit of olive oil to your water, and you can also add oats. Oats are really great for dry skin or skin that are easily sensitive. You can add oat flour to your water, a bit of it, and use it to take your bath and reduce your shower time. Another thing is, after you're taking your bath, immediately lock in the moisture by using an emollient. All right, so but Vaseline is not just enough because it doesn't have any other effects aside just locking in the moisture. So you want to also go in with maybe a moisturizer. Look for moisturizers that have ammonium lactate 15% or lactic acid because it helps the pH of your skin and also helps to improve the epidermal barrier. You can also add zinc to help heal the epithelial layer of your skin. For oral intake, you can include antihistamines like the less sedating one like loratadine. They help to reduce the itchiness because you would constantly want to itch. The truth is you have to try not to itch when you feel like itching, but sometimes it can be so uncomfortable that you almost find yourself itching. Try to avoid that. So taking antihistamines will help to reduce the itching. It's advisable if you take walks or you take exercise to take your antihistamines before embarking on anything that will cause heat or cause you to scratch. Another thing you can take is your corticosteroids. So most of these things might it has to be prescribed. So you can take like your prednisolone. If you notice that there are certain foods that you eat that causes your flare up, try and avoid those food, because for some people they can eat certain things and they can still be okay, but for some another person they can eat that same food and can cause a flare up. So if you notice that there's some food that triggers that, try and avoid those food. So in summary, if you have atopic dermatitis or you notice that you have eczema, try and number one, minimize the contributing factors, which can be excessive bathing or certain food that cause the trigger. You go for moisturizers, go for anything moisturizing. Your cream should be moisturizing, your soaps that you use for bathing should be moisturizing, and detergents that are sensitive skin friendly. Then afterwards, you go in with your topical steroids that is okay for the face and the genital area. Take antihistamines for the itch scratch cycle that you can have maybe towards the evening, the night. So loratadine as an example. And look for other topical anesthetic agents too, that camphor, menthol, because they are great itch reliever. So if all things fail, I recommend that you find a dermatologist so that they can recommend medications that is suitable for you. Let's have a conversation in the comment section. Let's talk about the skincare. Let's ask questions. If you have questions, ask in the comment section. Let's interact. If you're a dermatology specialist or you are into skin, let me know your thoughts in the comment section. Give your advices and what has worked for you if you had eczema in the past. I'll see you in another video. Make sure to like and subscribe. Bye.